Welcome to KFUG Community Radio, 101.1 FM and streaming online at kfugradio.org. You've tuned in to News Now, a co-production of KFUG Community Radio and Wild Rivers Outpost. We're going to tell you about some local news, now. For KFUG Community News, I'm Persephone Rose, and I'm joined by KFUG Station Manager Paul Kritz.
While county health officials do their utmost to understand the origins and possible consequences of the first 2 confirmed cases of COVID-19 in Del Norte, it appears that social distancing is, indeed, flattening the curve, both locally and across the state. But that hasn't kept Sutter Coast Hospital from preparing for a possible surge in new cases. I sat down yesterday with Wild Rivers Outpost Jessica Sanar and spoke with Sutter Coast CEO Mitch Hanna about the steps the hospital and Sutter Health are taking to prepare. At the press conference at the Flynn Center about a week and a half ago, you had said that the hospital, Sutter Coast, would be able, hopefully by the next week, to do in-house testing. Did that happen?
It has not. We have the equipment. We do not have the test kits, and actually the reason for that is as we explored the testing structure, it would take a couple of tests to basically confirm that the testing equipment was correct, and the system didn't feel like we wanted to waste that using, having separate locations. So we did create a central lab, and we were doing most of our testing through the central lab. So if a patient is swabbed here, which we do swab them here, we send that out. If we send it out by 10 in the morning, and we get the results back the next morning, so it's a fairly quick turnaround. If it goes out later in the day, it takes longer because of the courier structure. But we are currently not doing the tests here. As we get more kits as a system, they may distribute those to us, but for the time being, we're sending those to our central lab. So it is a Sutter lab, but it is in the Bay Area.
Okay, and who controls the availability of the tests for you?
That comes through CDC.
Okay. How do you decide who gets tested?
They need to be symptomatic, essentially. So if a patient shows up and has symptoms that would suggest that they could be COVID positive, they would get tested.
Okay, and they're just a matter of them showing up at the hospital, at the ER, at the behest of their personal.
Yeah, or the walk-in clinic, preferably the walk-in clinic. We're not encouraging people to show up at the ER unless they, really require, urgent care, or emergent care.
And it's my understanding that the 2 confirmed cases we have now are not requiring hospitalization. They're at home.
That is correct. I just want to commend our community for adhering to the recommendations of the federal government and sheltering in place and washing their hands and all that good stuff that has really helped to mitigate the spread of this virus.
Now, so much of our local angst over what possibly could be happening in the next few weeks is based upon just how small a hospital Sutter Coast is for the region it serves, and ordinarily there's a 49-bed capacity, correct?
That's correct, but we have a well-developed surge plan as part of Northern California's critical healthcare infrastructure. We're working cooperatively with the local, federal, and state agencies. Our system has developed or activated a 24/7 emergency response system. So we're tied into that. We actually, this dates back probably 4 weeks ago, canceled or postponed elective surgeries to free up supplies, staff, and space. We've converted some of our post-anesthesia care unit and other step-down units to handle critical care patients. We've reduced visitors entering the hospital. We've increased our supplies of personal protective equipment and essential equipment like ventilators. So we're feeling very prepared. We've got capacity roughly for an additional 20 beds if needed. So we've set up a triage tent outside of the emergency department, so people come in experiencing symptoms. They would be evaluated and triaged based upon whether they're actually having respiratory issues, in which case they would be referred into the emergency department. And if not, they would be given advice in terms of how to care for themselves at home. We've also set up, and I did want to specifically mention this, we've set up an advice line, and this is not strictly for Sutter patients. So, anybody in the community who's feeling that they might have symptoms and just want information about COVID-19 can call this advice line. It's a resource for any community members, and when they call the COVID-19 line, a registered nurse will direct individuals to the appropriate care, and we want patients who have mild symptoms to understand how to take care of themselves at home so that they don't overwhelm the healthcare system. As you noted, we're a small facility, but if we manage our resources effectively, we are very confident we can deal with this pandemic. And then patients requiring medical intervention would be directed to the most appropriate level of care. And if you don't mind, I'll give you that number that you can share with your listeners. It's 866-961-2889, and that's open 7 days a week from 8 a.m. to 6 p.m. Pacific Standard Time.
I assume this is all part of dealing with a surge and the plans to deal with the surge, but somebody say is having a baby, something, an ordinary medical emergency. Are there any things in play to mitigate their exposure coming to the hospital? I mean, it seems like COVID-19 could take over Sutter Coast, but what about all the other cases that would be here in the county just ordinarily?
Well, we continue to see patients with other illnesses that now, obviously, as I mentioned before, these are not elective cases, but we will separate COVID positive and rule out patients from the rest of our patient population. So no, we do continue to have deliveries here and see other medical patients who require immediate care, mm-hmm. and they are generally separated from the COVID-positive patients.
Right. And then we've been following with the community radio station up in Brookings, all the stuff that's happening with Curry Health. Has Sutter furloughed anybody here locally?
We have not, nor do we have plans to. Right now we're just, in those departments where we have stopped, taking elective cases. For instance, our physical therapy department, most of the patients that they see there are elective. So we've redeployed those staff to other areas. And in our surgical area, the surgical nurses, without doing elective surgeries, as you might imagine, is the majority of our surgical cases. Those staff are being trained to work in the emergency room setting or to work in the critical care areas or on the medical surgical unit should the need arise. So rather than furlough staff or layoff staff, we have offered training and development to broaden their clinical expertise in order for them to help manage the surge should it arrive.
Have you seen an increase in visitors patients to the hospital in the ER, the urgent care, the walk-in clinic, or in the hospital in general as a result of the emergency?
No, ironically, we have not. In fact, our volumes are significantly lower than what they were a month ago or what we normally see at this time of year. And again, I think that's a tribute to our community. People are sheltering in place. If it's not something that's absolutely urgent, they are staying home, and that's where they should be. And that's not unique to Sutter Coast. Our system has seen that. As you may or may not know, I'm also the CEO for Sutter Auburn Faith Hospital, and our volumes there are roughly half of what they normally are, and Auburn is a suburb of the Sacramento area, and that's a national trend as well. So I think it's a tribute to our community and to our country that people are really heeding the advice to stay at home unless they absolutely have to leave.
I wanted to ask you if you could just kind of characterize what's the mood at the hospital as we sort of sit and wait and see what's going to happen.
I think everybody is prepared. As I shared last week, we're preparing for the worst and praying for the best. And I think we're all cautiously optimistic that, perhaps we dodged a bullet by really staying at home, washing our hands, masking as we're requiring all of our staff to do now. But I think, people are just prepared, and we're taking it a day at a time. And again, I just want to encourage people, if they have any concerns or need more information, not to hesitate to call that number. As I said, they don't need to be an Auburn or a Sutter Coast patient, and they can at least get some information and perhaps have their concerns addressed over the telephone.
That Sutter help number again is 866-961-2889.
In response to the COVID-19 pandemic, opportunities for financial relief for businesses have appeared. These efforts address the problems that businesses are facing, but little has been said for programs that offer relief for individuals. Employees are being furloughed across the nation. Even close to home, the Curry Health Network recently furloughed nearly 200 Curry Health employees. More information about this can be found at kciw.org for KCIW Community Radio in Curry County, who have closely followed the story. We reached out to Christy Hernandez of the Del Norte Workforce Center in our search for individual relief. She had this to say.
So, staff at the Workforce Center have been helping folks file for unemployment. We've been doing it over the phone mainly. If people don't have access to computers on their own, we could do it over the phone for them or get them in contact with an EDD representative. We usually refer them over to the Reading office. That's similar to us because they have EDD workers there, and they actually answer the phone, unlike when you call the 1-800 number for unemployment and you get nobody usually. We try to help in any way we can. We have the resources, but we don't have EDD staff in our office, so we help with this regularly, but this is just kind of accelerated, of course, due to all of this. We've been getting quite a few calls on unemployment, how to apply, what to do. We also have paper applications that we have kind of set outside in a basket outside our front door at the office, since our office is closed right now. Everybody's working remotely, so if anybody had any questions regarding it, they could always call our main number and talk to somebody during regular office hours. So that's one thing that we're trying to do with the whole unemployment thing. I know that because of the CARES Act that was signed and passed, they're putting extensions out there for folks to give them longer time on unemployment, which is nice, potentially a little more money on top of what they would regularly get for unemployment, which is good.
You said there's that you've had a higher volume of folks. Any idea how many more folks have been asking about this than usual?
Unemployment. We've been trying to keep a running list of how many folks are calling in. I'm thinking, because we've put on our website links to how to apply, because in the very initial time of all of this, people were calling and saying, I went and I filed for unemployment and they're asking for a credit card, and so there's those scams out there now that we try to make sure that people go to the right website too, that it's a .gov website and not something else where they're going to ask for money from you, it's ridiculous that people are trying to find ways to scam people during this time, but right. That's how it works.
So what's the best? Is there a best website just to go to EDD or to the Workforce Center? I mean, what's a good first stop?
They can go to the Workforce Center, and there's links under resources, and actually at the very top of our page there's links to the website. But if they just go to edd.ca.gov, that's the website they want to start at. And there's, on our website too, there's links to tell you how to get started initially, because you have to create an online account with them in order to file. It's a new thing they started maybe about a year or so ago. So we have resources for people if they can access the internet and have a computer or have their smartphone to go on and at least click on those links just to kind of give them some more information. And if they get stuck and if they say, this is just too much, I don't know how to figure this out, they can always call us. We'll help them through it.
And what's the number at the Workforce Center?
It is 464-8347. And as soon as they hear the voicemail come on, if they just punch in 153, that will route them directly to one of our staff.
Excellent. And in the email, you'd mentioned that there's a grant the Workforce Center's received to specifically address some a limited number of COVID-displaced workers?
Yes. So through this, we were able to get, it's called additional assistance funding through the state that the consortium that oversees us, it's called Norte. They oversee 11 counties in the north part of California. They have applied for this additional assistance money. Us being as small as we are, we usually get a smaller portion of the funding depending on what's out there. So we have, between Siskiyou County and Del Norte, because we are together at this point as far as the organization that kind of runs us, we have only the ability to help 10 people, put them into like a temporary work experience situation where they're getting paid. It's going to be potentially through like with the food banks to help what they need to kind of get all that distribution out, as well as maybe the school district. We're working on the work sites right now to see how we can make this happen, but at least it'll get a few folks back to work that maybe aren't able to get unemployment right now for one reason or another, and are needing a little extra money in their pockets. So we're hoping that can start in the next couple of weeks. We also are putting out still our weekly job listings, which might be surprising because people think that there's maybe not a lot of jobs out there, but each week we're having new jobs that we're posting on there. So I think just directing folks to the website to look at the job listings on the Workforce Center website as well. We're still putting them out, and there's still folks looking for workers. So
wow,
people are interested, yeah.
You can find the links Hernandez mentioned on the Del Norte County Workforce Center's website, dnworkforcecenter.org. For more information, you can call the Workforce Center at 707-464-8347.
Now this statement from the Yurok Tribe. The Yurok Tribal Chairman, Joseph L. James, has issued an emergency closure order of the Yurok Reservation in response to COVID-19 pandemic effective on April 4th, pursuant to the Yurok Constitution. The Yurok Reservation will be closed to non-residents. However, essential tribal government employees, authorized vehicles, and essential services will continue to have access. State highways will still be open to through traffic. This order has been issued to protect reservations' residents' health, safety, and welfare. A Facebook Live video was released the same day by Yurok Vice Chairman Frankie Myers to address the community regarding this closure in response to the COVID-19 pandemic, which can be found on the Yurok Tribe's Facebook page.
For Del Norters who know how to sew and are looking for a project, the local public health branch is collecting homemade face masks. Del Norte County Public Health Nurse Shelby Bodenstab told the Wild Rivers Outpost on Wednesday, quote, "Our thinking is we would give them out to the clinics in order to give to the public for patients who are walking in and coughing. It's not necessarily for healthcare providers who are providing care to patients, not at this point," end quote. Bodenstab continued, quote, "People are really willing, as they spend time being stuck at home, to help us out. We thought this would be great to take advantage of, and our hope was to direct those activities so people weren't calling hospitals and clinics asking where they should go. We could be the repository for that," end quote. As emergency officials at the local, state, and federal level prepare for a surge in COVID-19 cases, resources are scarce, Del Norte Public Health Officer Dr. Warren Raywalt said in a presentation to the Del Norte County Board of Supervisors. Raywalt said, quote, "We need more personal protective equipment. We need more ventilators, oxygen concentrators, basic medical stuff to get the job done and take care of people," end quote. Hand-sewn cloth masks can be dropped off from 8 a.m. to 5 p.m. Monday through Friday at the Del Norte County Public Health Branch, 400 L Street in Crescent City. People are urged to call 707-464-0861 before they drop masks off to ensure someone will be able to accept them. It is important to note that with recent developments, especially locally, in which there have been 2 confirmed cases of COVID-19, that you should wear a cloth mask when going out for essential needs. But remember, cloth masks are a great line of defense in addition to proper hand-washing hygiene and social distancing.
Though negotiations with teachers continue, Del Norte Unified School District and union representatives for its classified staff reached a tentative agreement on its 2019-2020 contract. This tentative agreement comes from DNUSD classified and certified staff figuring out how to meet students' needs in the middle of the COVID-19 pandemic. In a joint communique announcing the agreement, the Board of Trustees recognized those on the, quote, front lines of keeping our schools safe and clean and our children fed. DNUSD's Human Resource Director Colleen Parker and George Mercado, president of CSEA Great Northern Chapter 178, signed the agreement Wednesday. In a written statement to the media, union representatives stated they appreciate the recognition the Board of Trustees has given to their work. Quote, our hope is that, as we move forward, the district and CSEA continue to work together to value and respect the classified staff that can always be relied upon to show up on the front lines every day, in every circumstance, to support our schools and our community. These unprecedented times have proven that classified school employees are essential. Under the agreement, the DNUSD authorizes a 3% increase across CSEA salary schedule retroactive to July 1, 2019. The district would also increase its contribution to classified staff's health benefits by $100, capping it at $9,600. The agreement also authorizes a one-time 0.5% pay supplement for staff normally contracted to work between July 1, 2019 and June 30, 2020. According to the agreement, DNUSD and CSEA representatives will negotiate how that 0.5% pay supplement would be applied. This stipulation came about as a result of the Board of Trustees' emergency decision on March 15th to close schools because of the COVID-19 crisis, Parker told the Wild Rivers Outpost. She noted that classified staff, particularly those in the Nutrition Services Department, began working 10 to 12-hour shifts to keep kids fed. Parker said, quote, they've really had to step up and do things that are more difficult. And they're out on the front lines making sure kids are getting fed. They've served more meals than they've ever served.
The Del Norte community has lost an estimated $1 million in revenue as local businesses struggle to stay afloat amid social distancing requirements due to COVID-19. At the last City Council meeting, City Manager Eric Weir spoke out on this in regards to the transient occupancy tax. Weir explained the city's general fund consists of 2 main sources, transient occupancy tax, or TOT, and sales tax. At this point, Del Norte County is not receiving TOT because of compliance with the stay-at-home order. On the other hand is sales tax. As part of trying to help small businesses out, the governor's orders are that small businesses can actually defer their sales tax for up to 12 months, which means it's not going to come to the city, according to Weir.
The Redwood Coast Transit Association has made an official update on how it will operate during the COVID-19 pandemic. On April 4th, they released the following information. After seeing non-essential trip-taking increase in recent days, RCTA has decided to end its trial period of elimination of all fares. Effective Tuesday, April 7th, 2020, RCTA will resume requiring its normal cash fares or valid passes for boarding all buses. There are more COVID-19 related changes happening this week. RCTA must adjust its service levels to the dramatically reduced travel demand and reduced staff availability. The following service changes went into effect Monday. Crescent City local routes and Dial-A-Ride will shut down at 6 p.m. All Saturday service is eliminated, including regional and Crescent City local routes and Dial-A-Ride. The late morning trip of Route 20 between Crescent City and Arcata, departs Crescent City at 10 a.m., is eliminated. The last evening trip of Route 20 between Crescent City and Smith River, which departs Crescent City at 7:42 p.m., is also eliminated. The last evening trip of Route 20 between Crescent City and Klamath, departs Crescent City at 7:05 p.m., is eliminated. The late afternoon trip of Route 199 between Crescent City and Gasky, which departs Crescent City at 4 p.m., is also eliminated. You can find more information about developing changes at redwoodcoasttransit.org.
For small businesses in Del Norte, COVID-19 has presented an existential threat. Many businesses have closed temporarily, a couple for good, while others are struggling to understand what being an essential business really means. In order to get local businesses in touch with the assistance coming from the state and federal governments, as well as provide policymakers with an ongoing record of how the pandemic is hamstringing local businesses, the city and county teamed up to create the Economic Resiliency Task Force, headed by the city's Recreation Director Holly Wendt. KFUG Community News spoke with Holly today by phone to get the latest on the task force and its work.
All right, so if we can, I want to begin with, what is your title in all of this? Because this isn't just a rec department thing, right?
No. So I work for the city of Crescent City as the Director of Recreation and Events. But as this COVID-19 pandemic developed, we were keeping an eye on what other counties and Humboldt County were doing. And we saw that they had developed a task force as part of their emergency response team in order to help support businesses. So we quickly organized a task force, and we're calling it the Economic Resiliency Task Force, which is part of the Office of Emergency Services. And so right now I am the team lead for this task force, trying to stay ahead and on top of what this pandemic is doing for our local economy and our wonderful local businesses.
What then is the goal of the task force? How will you address that end?
So one of the first things that we know that we're going to need to do, because this is actually a disaster and not like a normal disaster where the disaster hits, say like a tsunami, and then it's over, and then you can quickly work on rebuilding the economy and the infrastructure. The way this one is hitting is that it's a health disaster, and it will affect the health of people, but right now it's currently affecting the economy and the businesses and the local economy. So what we're doing is we're starting to collect data with an economic injury survey, which is necessary to get future funds related to the disaster, and trying to track how it's impacting our community. Loss of income, loss of employees, our unemployment is rising. We're tracking all of those things so we can show that the end results are directly related to the COVID-19 pandemic in order to justify the funds or support that we'll need. That's one of the things that we started doing 2 weeks ago. The other thing we're doing is we're trying to get a good group of people together to be able to understand some of the resources coming down through the federal government through what a lot of people have heard about as the CARES Act. It's a big document with a lot of language that's really hard to get through, and luckily the city has put aside some funding for 2 consultants to help us, as well as a local amazing team of businesses and staff from from Del Norte County and the city, and also Chamber of Commerce. So we're sifting through all that information and trying to put it in terms that are easy for our local businesses, and also give them tools to navigate those things, like the Payment Protection Program or the EIDL is another program. All these are acronyms that take a little bit of diving into to understand.
And what role are the consultants playing then as far as sorting all of this out?
So we have 2 different consultants. One of them is working specifically with an amazing program we were able to get together really quick, and that is the Del Norte Small Business Stabilization Loan, where we have $140,000 that was brought together by some great foundations. The Gil Hess Foundation, the Jane and Baird Rumiano Fund, the South Fork Big Flat Fund, the Caldwell Clan Fund, and the Nick and Lisa Rail Fund. So we have $140,000 that we are able to give out in zero interest small business loans that won't need to be.
I'm sorry, that's money generated right here in the community?
Yeah, and
wow.
It only is for our community. So we get to support local businesses right now. The applications were available last week. And we have Chuck Wolf he's one of our consultants, and he's been working in this field for over 30 years and has been a business owner for most of that. And so he's going to do one-on-one advising with each applicant to not only help them move through the process for this loan, but also help them understand if they're available for the SBA disaster loan, the PPP loan, or the EIDL loan, and help them navigate it through it. So we're accepting 40 applicants, and just to be able to allow 40 people to be able to work with Chuck.
Okay, just with that specific consultant is that's the capacity, 40 applicants?
But he's also available. We're going to use him as much as we can during this process because of his experience. He's also on all the task force meetings we're having. The other consultant we have is Rob Homeland, and he's working with us on the loan, but also on other projects that are important to the community and the business. We just did a webinar yesterday, which Rob Homeland facilitated, explaining these different programs and why we're doing what we're doing. We're also trying to work on how to help some of our businesses get more creative. We're looking for webinars coming up on how to be a personal shopper in your store for people, and how do we publicize that and encourage people to buy locally to keep our businesses afloat during the next couple of weeks as we figure out how this is going to develop in our community. So we're just trying to really think creatively and to really put a lot of effort to help these businesses right now.
That's amazing, and so much work because everything seems to be changing just, from moment to moment. Where are you in the process of building all of this? I know that you've been doing the webinars and you're trying to get a YouTube video up so that we'll explain things. How far? I don't know how to even ask this question. How's it going, getting all of this organized? How far along in the process are we?
Well, I have to, I think that we had such an amazing head start just by, luckily Rob Holmand is working with us, but he's also working down in Humboldt County. So we had eyes and ears on what people were doing down in Humboldt County and other places. And we're small and we work really hard, and we've got an amazing team in Del Norte County. So we're really ahead of the game compared to other counties. For example, Siskiyou County called me yesterday and heard about what we're doing and wanted to get ideas and tips on how to get some of the programs together that we have. I think Humboldt County just got a loan together for their local businesses. Ours has been up for a week. So we already have, I think, 6 or 7 programs already started through, applicants started through that process to get those loans. And we're working really hard on finding other areas to support them. So even though it hasn't been that long and everything's changing day to day, I think we're moving pretty good. Not as fast as we hope we would be for the businesses because they're feeling it, every second. The webinar we had last night, we are all learning how to live in this technology world. Like you said, this YouTube video, I've been battling it with it all day to post the webinar we did yesterday, but that should be up anytime today that people can go to the website, and the website is Prepare Del Norte. That's the Office of Emergency Services webpage. And on preparedelnorte.com, there's a link that says COVID-19 business support. There's a button you can go to. Mm-hmm. And on that page that has links to supports in the community, it has a link to the economic injury survey. It also has a link to the loan, and in just probably about 45 minutes, it's going to have a link to the webinar we did yesterday so that businesses can see it. And we'll also be posting that on Facebook and on Instagram today.
Is that the primary point of interface for somebody, for a business? Should they go? Is that the first stop, preparedelnorte.com?
Yeah, I think that's the best place because we are, this task force. I work for the city, but this task force is a multi-agency. It's a team of people throughout the community. That's where it's housed, is on the Prepare Del Norte page. I would go there. We also on the city webpage have links to it. And I know the county has links on other sites, and in Facebook you can find it as well. But the main home is preparedelnorte.com, and then COVID-19 business support will take you where you need to be.
All right. Looking forward then, the rest of this week, what's that look like for you? What are you hoping to accomplish with the task force?
So for the rest of this week, we're working on a lot of things. We're really hoping that the community, we asked businesses to do the survey. We had over 115 businesses do the initial survey. Now we have the second week up, and so we need people to go back in and update us. How is it impacting them 2 weeks into this? And we'll be doing that every 2 weeks. So we can pull current data. So we really need businesses to go in and do that. We are looking at giving more information to businesses about if you're a necessary business, how do you stay compliant? What do you need to know? We're also working on tools and tips for businesses to do online shopping. We're working closely with the chamber. We have the first draft of all the restaurants that are open for takeout. Mm-hmm. You'll probably be seeing that link later in the week, all in one space, so people know where to go. And anyone can call me on my phone number, 951-3003, if they have any ideas or if they have any questions. We're all trying to make this work as we go, and we're open to input, and we're also open to helping people. So if any business owners have questions, they can call me.
Wow. Thank you so very much for talking with us today, Holly. Is there anything that I haven't asked that you want to make sure gets said?
No, I think that we're so grateful for our local businesses. We're asking a big thing of them to close down. Some of them have to close down entirely right now. Other ones are taking huge hits just to keep everyone safe. And we're just so grateful for them doing this.
That's true.
So just to thank them, as well as all the necessary workers out there and healthcare providers, this is a huge community effort to keep people safe, and we're just super grateful.
Another local organization reaching out to businesses in conjunction with the Resiliency Task Force is the Crescent City Del Norte Chamber of Commerce. We spoke today with Director Cindy Vosberg to find out how the Chamber is adding to the effort.
We are not financial advisors. We don't have, big pockets that can help people. The thing that we felt from the beginning is that we can communicate. And so we went ahead and populated a spreadsheet that our employees have been making outbound calls to every chamber member and now every business in Del Norte County and seeing what their needs are, letting them know about the survey. We helped create a survey with Holly Wendt on what questions to ask folks to ascertain what their challenges are. And then what we do is we reach back out to those folks after they've taken the survey and give them the resources, where to get the resources of what their needs are.
On an individual basis, you're doing this with businesses?
Yes, on an individual basis, right.
Wow.
So, it's so important. One business, one of my first calls out, I guess we're now into our third week of this now, was to a business owner that because her shop was closed, and because she lives alone and is a little bit older, and she has a retail shop, that she had not spoken to anybody in days. And so just the fact that we reached out and was able to have a conversation with her for me, it was, heartfelt. And for her, it helped her feel not so alone. So that's the goal there, is to let the business community know they're not alone in this. And then after that, to try to get them to the resources that are available. And with things changing daily, it's a challenge to stay up on what actually is available and what isn't.
If you are a local business seeking assistance, the place to start is preparedelnorte.com. You can also find guidance at the Small Business Development Center's website, northcoastsbdc.org, and the Chamber of Commerce's site, delnorte.org. Thanks again for tuning into News Now. To hear more episodes, check out our website, kfugradio.org, or our YouTube channel. Special thanks to Wild Rivers Outpost and Jessica Sanar, Crescent City Bureau Chief, for providing great content. Tune in 2 weeks from now to KFUG Community Radio 101.1 FM and streaming online at kfugradio.org to hear more from your favorite local radio station.